The University of Ottawa presents bedside ultrasound to facilitate gynecologic procedures. Our disclosures are listed here. At the end of this video, viewers will be able to identify procedures in which ultrasound may be helpful, follow a stepwise approach for bedside ultrasound, and troubleshoot challenges with poor ultrasound visualization. Ultrasound was first used as an operative adjunct by urology in 1961 for detection of renal calculi. In the 1980s, gynecologists adopted bedside ultrasound to ensure complete cavity evacuation during therapeutic abortions. Today, many centers use ultrasound concurrently in ORs, outpatient procedure suites, and in many clinical settings. Ultrasound is an ideal adjunctive tool to use in gynecologic procedures because of its excellent pelvic structure visualization. All hospitals and many academic offices already have access to an ultrasound machine. It is portable and thus easy to share between offices and ORs, and it is safe for patients and operators alike. Many gynecologists are already familiar with ultrasound due to its prevalence in bedside obstetrical care. Concurrent ultrasound has been shown to decrease complications during termination of pregnancy, increase complete resection during hysteroscopic myomectomy, and decrease surgical time, retained tissue, and perforations during management of cesarean scar pregnancy, such as in the case shown on the right. We propose a simple stepwise approach to use ultrasound in gynecologic procedures, considering who would benefit from concurrent ultrasound, what supplies you need, when the bladder is adequately filled, where your point of interest is, how to gain the best images, and why you need ultrasound for your procedure. Step 1. Who would benefit from a bedside ultrasound for their procedure? The answer to this question may be different depending on where the procedure will take place, and there may be significant overlap between these locations. In the clinic, bedside ultrasound can be useful for confirming appropriate IUD placement, IUD retrievals, and difficult endometrial biopsies to confirm intracavitary samples. This patient had a history of a uterine perforation with her last IUD insertion requiring laparoscopy for retrieval. This time, concurrent bedside ultrasound was performed to confirm correct positioning of the IUD at the time of the insertion. In the outpatient hysteroscopy suite, bedside ultrasound can be useful to assist with challenging dilations, Asherman's cases, fibroid resections, and polypectomies. Studies have shown that myomectomies performed under ultrasound guidance result in a decreased rate of reoperation to achieve complete fibroid resection. Hysteroscopic procedures performed in the OR which may benefit from ultrasound assistance include molar pregnancies to ensure complete evacuation, cervical ectopics, hysteroplasty of uterine septums, and cesarean scar pregnancies. During this hysteroscopic lysis of adhesions, we use the ultrasound to orient ourselves within the uterine cavity to know how close we were to the fundus since our intracavitary visualization was very limited. The next question to ask is, what supplies do you need? Basically, all you need is an ultrasound, a skilled assist, and ultrasound gel. The skilled assist could be a sonographer, a colleague, or a resident. Most people have experience with obstetrical ultrasounds, and these skills are easily translatable to gynecologic practice. Step 3 is to consider when the bladder is adequately filled, as this facilitates sound wave penetration, creating a clearer image. If the bladder is too full, it may compress pelvic structures away from the probe or make the patient too uncomfortable to tolerate the exam. Asking the patient to have a full bladder or backfilling the bladder in the OR can optimize visualization. Step 4 is to consider where your image should be on the screen. Place the object that you are working with in the center of your screen. This is important both in vertical and horizontal planes. This may require adjustment of the depth on the ultrasound machine. Adjusting the depth of the field of view allows you to center on either superficial or deep structures. Patients with a thicker abdominal wall will require a greater increase in the depth of your field to visualize the uterus. The focus knob should also be manually adjusted to provide optimal definition of the uterine cavity. Positioning the focus arrow at the level of the uterus will improve your image clarity. The two orientations you will be holding your probe are in transverse as seen on the left and sagittal as seen on the right. In order to fully identify your pelvic anatomy, you should perform a sweep in each plane of view before you start the procedure. In this ultrasound clip on the left, we see a slow sweep in sagittal plane from one side of the uterus to the other. Step 5 is to decide how to gain the best images. If your image is too dark, first ensure that you have good contact between the probe and the patient and enough ultrasound jelly. Next, you can increase the gain, which amplifies the received signal, resulting in a brighter image. Avoid increasing the gain too much, as this can result in artifactual echoes in fluid-filled structures. Step 6 is to consider why you need ultrasound. Not only does it allow you to perform more challenging procedures with confidence, but it also ensures successful completion of the procedure. And these things together result in overall better patient care. So the real question is, why wouldn't you use ultrasound? Here we present a case of a cesarean scar ectopic that was removed under bedside ultrasound guidance to ensure complete removal of the products of conception. Here we can see the curette moving within the uterus and confirm that there was no evidence of perforation or evidence of residual tissue. We hope that we have helped you identify situations in which bedside ultrasound might be helpful, provided you with a basic stepwise approach to using concurrent ultrasound, and given you some simple troubleshooting techniques for optimizing images. Thank you for your attention.